This is another example of a person, okay, who presents with right knee pain, and then you can see that even though the knee is a problem, but when you look at the hip, actually there is a lot of arthritis in the hip. So before we treat the knee, we have to treat the hip, and this person had a hip replacement, then followed by the knee replacement at a very young age, but she needed it because she had to be active. She's still young, and if you have multiple joint problems, it's very hard to be active. You can't travel, you can't go to the market, you can't go with your family. So sometimes you need to do this to restore the quality of life. So the point here is we want to improve our joint function. As we age, we want to make sure that our joint function is preserved and we can still have a good quality of life. So quality of life is very much dependent on the functional ability of a joint. Who has not much of a problem, but you can have an 85-year-old which becomes a problem to the person. Alright? So we are not treating the X-ray, but we are treating the patient. Because everyone is different. You can have a 70-year-old who is still traveling around the world. Right? Age is not a factor, right? But it's how active the person is and how much the knee pain is actually troubling the person. Alright? So if you are not very active, you are just at home, maybe it's not a big issue for you. Though the arthritis is there, but it's not a problem for you because you're not very active. Alright, so what happened to these two people? Because the knee is all like this is what I mean. You see a lot of ulceration, then they ended up with a knee replacement. But the idea of surgery here is to improve the quality of life. So of course, they had knee replacement done for both the patients, and you see the function gets better. And with time, you see this person now is happy. She can play with the grandchildren again, and even this person at 80, it's now active again and she's happy. Meaning that she can do her activities of daily living and she's not dependent on painkillers. And prevent the complications, okay? Because if you adhere to all these preventive measures, you can retard the rate of deterioration. It doesn't mean you avoid the problem. The problem will still happen, but the rate of progression can be lessened. You can have less pain. Also important, early diagnosis and early treatment. You can also prevent falls. Ultimately, you want to have good pain management. That means you want to have a pain-free life. Because when you have no pain, then you can at least also improve your quality of life. At the same time, you can also do aqua aerobics. You can also go down to the park and do some exercises. But if you're in a lot of pain, you can't do that. So pain management again is important so that you can do a lot of good rehabilitation and physiotherapy. Alright? Now this is again very important, regular visit to the doctor, because they are the first line to see you, your family physician. So if you have any problem, they are the first ones who will see you. So whenever you have an issue, whether it's due to a medical problem or bone problem, go and see them. Let them investigate, and if there is a problem, they will accordingly refer you to the specialist. But what I want to really highlight here to you, all of you today, is a very important link which is missing. And I think this can only be reinstated by good education and awareness, and that is what is in red here, the concept of physiotherapy. Alright? Whether you do a surgery or you don't do a surgery, physiotherapy is very, very important. Why? Because if you look at this model here, the knees, just like most joints, are stabilized by muscles. So if your muscle is strong, it will make the knee more stable and stronger. Then when you walk, at least then you'll have less pain. Okay? But what is happening is, because there is pain, when you walk, you don't put much weight on that leg. You'll have more pain in the knee because all the load is taken by the knee. The muscle is not functioning at its optimum level. Right? Then when you have more pain, again you will use the muscle less. So it is like a vicious cycle. Okay? Menjadi satu lubang yang akan menjadi lebih mendalam. You understand? Because pain, you don't use your knee, muscle become weak. Muscle become weak, cause more pain. And more pain, again you don't use your knee, muscle become weaker and weaker and weaker. So the best way to combat this is by doing a lot of physiotherapy. Physiotherapy simply means exercise to make the muscles around the joint stronger, so that when you walk, the load to the knee is reduced because the muscles are actually taking a lot of the load, and therefore you have less pain. It is not to cure the problem, but is to have less pain. Because the idea here is you want to be active, you want to be ambulant. Very important when you're walking.
locking the muscle at the front. So hold for 30 seconds. If you cannot, 5 seconds. How long you can do without pain? One day you can do around 5 and 3 times a day. Okay? So the exercise வந்து நீங்க 30 seconds